Imagine a sugar pill that can relieve chronic pain or improve Parkinson's symptoms. This isn't magic, it's the placebo effect, a real biological phenomenon where belief itself triggers measurable changes in the brain and body. For decades, the placebo effect was dismissed as a nuisance in clinical trials, a statistical noise to be controlled for. But today, neuroscience reveals something far more astonishing. Belief itself can trigger measurable biological changes. When a patient receives a placebo, a sugar pill, or a saline injection, their brain activates specific neural pathways in response to the context of treatment. The doctor's white coat, the ritual of taking a pill, the expectation of relief. This context triggers the release of endogenous opioids, dopamine, and other neurotransmitters that can reduce pain, improve mood, and even modulate immune responses. The placebo effect is not a trick of the mind. It is a biological phenomenon rooted in the brain's capacity to shape the body's physiology. The line between real and imagined medicine begins to blur. The term placebo comes from Latin, meaning "I shall please." In the 18th century, physicians used inert remedies to placate patients who demanded treatment for ailments with no known cure. But it wasn't until 1955 that the placebo effect gained scientific attention. Harvard anesthesiologist Henry Beecher published a landmark paper analyzing 15 clinical trials, concluding that placebos produced significant improvement in about 35% of patients, across conditions from pain to anxiety to wound healing. Beecher's work ignited a debate. Was this a genuine physiological response or just statistical regression to the mean? For decades, the answer remained elusive, but advances in functional neuroimaging in the 1990s and 2000s allowed researchers to watch the brain in action during placebo responses, transforming our understanding forever. Modern research, led by neuroscientist Fabrizio Benedetti at the University of Turin, shows that the placebo effect is a genuine psychobiological event. When a patient receives a placebo, their brain activates specific neural pathways in response to the treatment context. This triggers the release of endogenous opioids, dopamine, and other neurotransmitters that can reduce pain, improve mood, and even modulate immune responses. In essence, the placebo effect is the body's own pharmacy, unlocked by belief. The brain is not just passively waiting for drugs, it actively produces morphine-like compounds and other healing chemicals. This discovery has profound implications for medicine, suggesting that the ritual of treatment itself can be as powerful as the active ingredient in a pill. Pain is the most studied domain of placebo research. In a classic study, researchers at the University of Michigan used PET scans to observe brain activity in volunteers who received a placebo cream they believed was a powerful analgesic. The inert cream produced significant pain reduction. The scans revealed increased activity in the prefrontal cortex and anterior cingulate cortex, regions involved in expectation and emotional regulation, and a corresponding release of endogenous opioids in the brainstem. This was not just in their heads. The brain was actively producing morphine-like compounds that bound to opioid receptors, dampening pain signals. Crucially, when researchers administered naloxone, a drug that blocks opioid receptors, the placebo effect vanished. This proved the response was mediated by the same biochemical pathways as morphine. Perhaps even more striking is the placebo effect in Parkinson's disease, a neurodegenerative disorder characterized by dopamine depletion and motor impairment. In a landmark study, researchers at the University of British Columbia gave Parkinson's patients a placebo injection they believed was a potent dopamine-boosting drug. Using PET scans to measure dopamine release, the team found that the placebo triggered a 200% increase in dopamine levels in the striatum, a brain region critical for motor control. Patients' tremors and rigidity improved, not because of a drug, but because their expectation of improvement activated the brain's own dopamine system. This study provided one of the clearest demonstrations that belief can alter neurotransmitter levels in the same way as a pharmacological agent. The placebo effect extends beyond the nervous system to the immune system. In a pioneering study, researchers conditioned healthy volunteers to associate a flavored drink with an immunosuppressive drug. After several pairings, the drink alone, without any active drug, suppressed immune responses, including interleukin-2 production and T-cell activity. This conditioning effect, known as the learned placebo response, suggests that the brain can modulate immune function through expectation and classical conditioning. More recent work by neuroscientist Karin Meissner at Ludwig Maximilian University of Munich has shown that placebo interventions can reduce allergic reactions, lower cortisol levels, and even improve symptoms in irritable bowel syndrome. The body's response to a placebo is a cascade of biological events specific to the condition being treated. The dark twin of the placebo effect is the nocebo effect, where negative expectations can produce real harmful effects. For example, patients told about potential side effects of a medication may experience those symptoms even when taking a placebo. Studies show that negative expectations can trigger the release of cholecystokinin, a hormone that enhances pain perception and increase anxiety and stress responses. The nocebo effect highlights the power of the mind in both directions. Belief can heal, but it can also harm. This has important ethical implications for how doctors communicate with patients. Understanding the nocebo effect is crucial for minimizing harm in medical practice and harnessing the positive power of belief for healing. The placebo effect reveals the profound connection between mind and body. If you found this exploration valuable, consider how your own beliefs might shape your health.